Oh.
I was just reading your tweet, Ido.
I was just reading your tweets.
Oh, geez, that's awesome. Good job, buddy.
All right, yeah.
All right. Hello there. I'm here this afternoon with Dr. Ido Weinberg. My name is Dr. Ken Rosenfield. I'm the section head for vascular medicine and intervention at Mass General Hospital. And I have the privilege today of interviewing one of the members of my section, the latest member of my section, the new blood, the future of vascular specialists in general, and that's Ido Weinberg. Ido is an Israeli physician who came to us about 4 years ago now, spent a couple of years in training, one that we shared him begrudgingly with the Brigham and Women's Hospital, Mark Krieger and Josh Beckman and Andy Eisenhower and colleagues over there. And for the last year he trained with us, and then we loved him so much and realized he is really a brilliant insightful person that we decided that we wanted to keep him on as staff. You know, Ido is one of the most talented, smart, inquisitive people that I know. He's got great investigative sense, if you will, and as I said, a very inquisitive mind. So it's really a pleasure to have you here today.
Thank you. I'd come every day if I knew I'd get all those superlatives. So thank you very much.
That's great. So tell us a little bit about your feelings coming into the section of vascular medicine. As you know, we created this section several years ago, and it's now grown to 6 people. And this is a little bit unusual. There aren't that many sections of vascular medicine, a couple of other places in the country, but we've become quite robust. What's it like working in our section, and in particular, working with people like Mike Jaff and Doug Drachman and the like?
So thanks for starting off with an easy question. I think, you know, coming from Israel, I didn't know exactly what vascular medicine was just starting off. And coming into a robust section where everybody cooperates and there's a place for everyone, and sort of being able to grow into a section that already exists is a huge opportunity and a huge advantage, I think. As you know, and probably most of the viewers know, vascular medicine is a very heterogeneous profession at this time. Oftentimes, vascular medicine specialists will find themselves working alone. Sometimes they'll find themselves working side by side with surgeons, sometimes with interventional cardiologists, sometimes with interventional radiologists. And having the opportunity of working in a group that is minded for vascular disease is both unique and a huge advantage, I think. You mentioned a few names of people that I love working with. I could start with my mentor and benefactor, Mike Jaff, who Michael has been great in educating me and in bringing me here, and he's been somebody to follow. And in everyday practice, he's somebody that I can basically go to and have him as a wailing wall on the one hand, and as a source of advice, of excellent advice. You didn't mention Bob Schoenfeld, who's also a unique hybrid of interventional and non-interventional vascular specialist, who's also a great resource for information. Then you didn't mention yourself, obviously, but working with you is obviously also a pleasure, and it's always amazing to see the unique cases that we get to be involved in because of your practice. Working with Doug Drachman and Joe Garasik is also a privilege, 2 seasoned clinicians who are maybe approachable to somebody like me and make life much easier. So all in all, I think it's a huge privilege, and it's also an opportunity of seeing how to build it right, how to make a nice mix of interventional and non-interventional people work together, I think.
That's great. In my opinion, I think I mentioned this, I believe you represent the sort of new generation of vascular medicine physicians or vascular specialists in general. And I guess I would ask, how do you see your role moving forward in the role of vascular specialists in general? How can we positively affect patients' lives? Is there a hope for that? And is the future bright for us in terms of our ability to impact patients in a positive way?
You know, obviously I don't know what my specific role is in that, but I can say that I do have an opinion about vascular medicine in general. I think that vascular medicine is a very clever idea, and I think it hasn't caught on yet as much as it should, and I think as much as it will in the future. I think as medicine in the whole world, and specifically in the United States, is going towards appropriateness, and as much as we're trying to find ways to treat patients in a cheap and efficient way, and proving that what we're doing is right, especially when sometimes patients do need intervention in this setting, and you have to sort of prove, in the future it'll be more and more common that you'll have to prove that what you're doing is appropriate for the patient. Having a non-interventional opinion in the mix makes a lot of sense. I also think that although there's a lot of overlap between what a vascular medicine specialist does and what general practitioners sometimes do, hematologists sometimes do, rheumatologists sometimes do, having somebody who sees the whole picture as sort of a pan-specialist can really benefit patients, especially because it's been my experience that and it's one of the cool things about vascular medicine, that no patient is like the other patient, and many of them are really complex, and they come in with a lot of sort of vague symptoms that you need to piece together. And having a non-invasive sort of pan-specialist type person being able to do those things, I think is also an advantage for the patient.
So in a sense, you can function as the quarterback for the patient to try to coordinate all the different aspects, hematologic, vascular issues, that obstructive issues, and risk factor modification, and so on and so forth. So do you see us working as teams in the future, teams of vascular specialists, each one bringing their own thing to the table?
You and I have talked about this a lot. I think both of us are really like working in teams, and I think I would say that both of us are team players. And I always find it really frustrating when in medicine people don't work in teams, and I think we should all strive to build cohesive and robust teams that are patient-focused. I know it sounds presumptuous and like something you'd say for a camera, but I am serious about that, and I think that if you put your ego aside and you try to help the patient, you know where to go to when you don't know what you're doing, and you know what expertise to bring to the table, I think it benefits the patient every time.
Yeah, I think, and perhaps with the changes in the care model that are being brought on by the Affordable Care Act and other economic realities, perhaps there'll be more opportunity for that. I hope, at least. So Ido, I consider you, first of all, Ido is such a brilliant and inquisitive thinker that we immediately, as we took you on staff, we made you director of the research component for our section, and you've done an amazing job with that. And I wonder if you would talk a little bit about some of the research initiatives and interests that you've developed and helped our fellows with, really done a great job of mentoring our fellows over the past couple of years.
So yeah, so that is a huge opportunity, because in Mass General, being sort of tapped into the Harvard vein, you do have a lot of opportunities that it's just a shame not to take advantage of. Our section, as you know, but maybe for our viewers, our section is clinically oriented, and our research is mainly clinical research at this time. There are several projects that we are quite proud of. One project, one of our focuses is IVC filters. It's a ubiquitous procedure for many vascular specialists across the country, and we felt that there's a lot to say about that, and we formed basically the largest registry, currently the largest registry that's been published, and we've actually had a recent publication accepted about that registry. We've actually forged a few collaborations with other centers around the country, and we were moving prospectively to collect data about these patients. So that's one type of project. A second type of project that we're interested in or a second topic we're interested in is renal artery stenosis. Another one of those topics in vascular medicine, like many others, where there's a lot of debate and the field is still wide open. And we felt that there's a lot despite the randomized studies that have been done because of their limitations, and pending Coral coming out in a few weeks probably, we felt that there's still a lot to be said from real life data and from a registry type data. So that's another type of project we've been involved in. We're also involved in appropriate care and appropriate use. That's a collaboration we've forged with multiple other players within the institution, including the management, and we're trying to assess the appropriate use of various interventions. Specifically, carotid disease was a first sort of field that we've looked into because of the lively debate that's been surrounding that field, but also we plan to expand that to other areas. We're part of national registries. So for instance, we're part of the FMD, Fibromuscular Dysplasia Registry, run by Olin and Gornick. We're one of the 11 sites, so we're very proud of that. We contribute to the registry, and in return, we ask questions of the registry. And like you've mentioned, we're very fortunate to have excellent fellows year after year, and we haven't neglected tapping into their talent and their wishes to advance by offering them some of these opportunities, and they basically collaborate with us, and they get publication and experience out of that, and we love to mentor them through that.
Well, I think the mentoring part is so critical to developing not just the expertise of these individual fellows, but also pushing the field forward and creating new. Like I said, you're the future. Well, you're creating the next wave of the future, and we who are more senior actually are so indebted to you guys for doing that. I think the appropriate use comment that you made is a really interesting one. I think that initiative that was spearheaded by Michael Jaff and Cray Milford at Mass General to define the appropriate use of endarterectomy and stenting, and it's very patient-centric model, no? I mean, I think it really does bring the patient in. It gets you to a point in the decision tree where you actually are forced to then go and get informed consent, and as part of that, provide information to the patient. It's
extremely patient-centered, and we're actually very proud of that. What the system does, it's not only a bland research question or a sterile research question. It involves patients in every step of the way, and it makes it sort of makes you want to involve the patients. You involve them, you show them the data, you show them your thought process, you show them where there is data and where there is consensus and where there is not, and patients can weigh in and you come to a joint decision. It definitely feels like that's the future of that field.
So tell me a little bit about the Pulmonary Embolus Response Team, what we call PERT. You've been very involved in the Pert Team at Mass General. That's an initiative that we hope to expand and maybe make like the FMD registry, develop a consortium, a national consortium of PERT centers. Tell me a little bit about that and your involvement with that.
So PERT is obviously your initiative, so I'm proud of for the opportunity to be able to just highlight my own small role in that. In our hospital, as PERT is a multidisciplinary way of treating patients with massive and submassive PE, and what we basically do from a research perspective is try to understand how that multidisciplinary approach to areas of uncertainty affects patient outcomes. We are collecting data about patients in a prospective manner, and we're trying to understand all those areas of uncertainty, which patients will benefit and which patients will not benefit from aggressive therapy versus conservative therapy, and if aggressive therapy, what type of aggressive therapy helps patients more. And just like you've mentioned, we're quite excited about the fact that we're just embarking on organizing a national consortium, because we feel that no one center can take, I mean, one center I guess can lead that, but no one center can take ownership about such a huge topic. PE are so common, and these questions are so ubiquitous to emergency department life, to medicine life, and it's one of the top mortality and morbidity related diseases now out there, so we feel that more centers must be involved, and we're also organizing that.
Absolutely. I think it's a great, that was very well said. Tell me a little bit about geologistscom. First of all, do you qualify yourself as an angiologist or a vascular medicine specialist?
So, that's an excellent question, because it deals with my website, and anything dealing with my website is an excellent question.
Okay, so tell us about your website, which is geologistscom.
So,
this is a fantastic initiative that Dr. Weinberg has created by yourself. Amazing.
So geologistscom started off when I was just thinking about coming into fellowship, and at that time, truthfully, I didn't know where I will land, and I actually didn't even know what the term vascular medicine meant. And just researching the topic from Israel, I heard about angiology in France and in Holland of all places, and they call vascular medicine angiology. So I bought the domains angiologist.com and theangiologist.com, .org, .net, whatever, and set up the website. During my fellowship, that website was a non-existing entity. Basically, I poured just new knowledge as I accrued it into the website. But as it grew, I've noticed that more and more people just from the web were utilizing it. And now it's become an education portal for everything that's vascular medicine. It's evidence-based. Many people are contributing to that. It has both written material and video content. It has board review material, which is very up-to-date. And it's, I'm proud to say that wherever I go, people basically know me as the angiologist, which is kind of cool.
So how many visits does it get? Is it?
Well, that's a trade secret. I can't share that. If I share that, I'll have to price myself up or down with people wanting to advertise. But I'll just say a lot, and all of them focused.
All right. So tell us, and congratulations for that, because it's really fantastic. So if you were talking to young physicians who are embarking on a career, what would you tell them about vascular medicine? How would you entice them to go into this as a specialty?
You know, very easy. I love it. I think they should at least give it a go. I think that any young physician who's interested in not being focused on one very narrow field, but wants to stay with a broad perspective, wants to work with relatively young patients, wants to really impact patients, and also work with many colleagues and not alone in your office or alone in your procedure room, but you want to collaborate with multiple specialties, this is the place for you. So if you're a people's person, if you like collaboration, and if you like thinking about different issues, I mean, every day is just different than the other, and I think that's enough to entice anybody who's curious into the field.
That's great. Well, I'm sure after this interview, there'll be many signing up, and in fact, we better get back on the tweet circuit so we can tweet about this and get all the young Twitterers out there to sign up for vascular medicine. Thank you very much,
right, thanks
Dr. Weinberg, for interviewing with me and spending this time.
All right, thank you.